Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with board-certified infectious disease specialist, Dr. John Brooks, and we're talking about hepatitis B in this segment. What is hepatitis B? What causes it?
So hepatitis B is another viral infection. Again, we talked about alphabet soup, so it's the B of the alphabet there. So hepatitis B is a viral infection. Again, it affects the liver. Now, hepatitis B is different than hepatitis A because hepatitis B is not nearly as easy to acquire. We don't get it by ingesting it. We have to have exposure to basically bodily fluids of another human being. So when we think about that, so it'll be blood, it can be saliva, and it can be sexual products.
So that's the answer to how is it spread is by you have to actually be
Intimate. Yes.
with blood, body fluids, sexual activity.
Correct.
Okay. How common is it?
So hepatitis B used to be extremely common because we didn't have a vaccine. But now that we've had a vaccine for so many years, it has really helped decrease the number of hepatitis B cases. Again, for the last quarter century, virtually every young person that gets their vaccines has been vaccinated against hepatitis B, which has really dropped the number of cases in the United States. It is much less common. Now, unlike hepatitis A, hepatitis B can cause what's called a chronic viral infection. Hepatitis A, you get it, it's over, it's done, you're immune forever, never to get it again. Hepatitis B is very different in that when your body gets infected with the virus, as it gets into the liver and starts making more of itself, it incorporates itself into the cells and it stays there forever in many people.
So it's, would you say that makes it more serious than hepatitis A?
Absolutely, because it causes a chronic hepatitis. And so chronic hepatitis can then cause chronic inflammation of the liver, and chronic inflammation of the liver can lead to liver cancer. And that is something that we see in other parts of the world where hepatitis B is more common and where it's transmitted commonly from mothers to their babies. And so it's a life cycle in their whole society. And so they have actually a lot of liver cancer. If you go to parts of Thailand and Asia, the number one cancer they have is actually liver cancer because of the hepatitis B.
Really? So those are the serious health risks that you think of when you hear hepatitis B.
Yes.
What are the symptoms?
So like hepatitis A, we really have a hard time telling the difference between each hepatitis when you get sick. You get fatigue and malaise. You may get some fevers, not a real common part, but you may have some low-grade fevers. And then you can get jaundiced, which means you turn yellow, your skin turns yellow, your eyes turn yellow, and then you get sicker as the liver starts to fail.
Is there a screening test for hepatitis B?
So hepatitis A, B, and C, all we have blood tests. So we can easily test for any type of the hepatitis viruses by a blood test. We can see what it is and is it active. We actually, through our blood testing, can see have you had hepatitis, are you immune to it, or are you chronic active? We can actually tell and then come up with a plan of what to do.
But it is not one of those screenings like everybody needs to have their skin checked every year. Everybody,
like a colonoscopy, correct.
Yes, the colonoscopy. It's not one of those widespread screening.
Correct. The only hepatitis right now that we do widespread screening for is going to be hepatitis C, which we'll talk about in a bit, and that's for people that are born before 1965. Because there was an interesting society change that occurred and people had a lot more exposure to that virus.
Okay, so what are the treatment options for hepatitis B?
So fortunately for hepatitis B, we have several options. So let's say right now I get a needle stick because I'm a healthcare worker. Well, I'm of course vaccinated, but what if I wasn't vaccinated? I can actually get an immunoglobulin, which is passive immunity, giving me immunity from other people so that I actually don't get sick from it. And then there's vaccines. Hepatitis B vaccine is given in a series of 3 shots, broken over about a half of a year. We give 3 different vaccines, and that gives us a great amount of immunity to protect us.
So, but you talked about the preventive vaccine that is given to all kids now.
Yes.
Is a preventive vaccine given like to at-risk groups?
So the answer is yes. In general, we want everybody to be vaccinated for hepatitis B, but people that are sexually active should be treated for hepatitis, given vaccine for hepatitis B. People that have same-sex partners should be given vaccination. People who are injection drug users should also have vaccination because they're much higher risk, and actually people in prison we try to give vaccines to also because it's a group of people tightly put together that increases their risk of getting hepatitis B. So the vaccine that we use, let's say you get exposed to hepatitis B, we'll give you immunoglobulin, and we also start the vaccine, because the vaccine, like polio, the polio vaccine, remember, is preventative and therapeutic. Hepatitis B is the same, is that it will help prevent the infection, and if you do start to get sick from it, it will actually help treat it.
Well, we talked a little bit about treatment, and how about chronic hepatitis?
So we have medicines, we have antiviral medicines. So if somebody does develop chronic active hepatitis B, we actually have antiviral medications that are highly effective. And the reason that's important, if you can suppress the virus, you suppress disease to the liver, we stop cirrhosis, which is the end stage liver process where the liver is failing, and we can prevent hepatic cancer or liver cancer.
In someone with chronic hepatitis, do you cure it?
So the answer is, in some people with antiviral therapy, they actually will go from a chronic active state to no longer being able to detect the virus in their system. It does happen in actually many people, but not in all. So we do have the ability with the antiviral therapy to actually get a sustained virological response. That's the term that we use. We hate to call it a cure. We like to see that the virus is gone. We've proved that it's gone by blood tests for a long period of time and say that they're good.
Okay, so this is someone who's going to need care and monitoring over a long period of time.
Correct.
And are they able to infect other people during this entire time?
So if you have active virus in your system, then you're infectious.
Okay.
And so people that are on antiviral therapy, we suppress the virus, and that's what's nice, so that their partners, especially if they're married, then their partners that they're living with have a lot less risk. So the viral therapy is very nice because it can prevent spread. And then, of course, the nice part about that is if you do have hepatitis B, and let's say you're a drug user, if you're taking medicine, you'll spread less virus. So it can help prevent the further spread.
So what I'm hearing you say is if you have hepatitis B and you're in any of these situations, you need to think through this impact, because you can infect your partner
Or others around you,
or
correct.
others around you. Very great information. Let's take another break. We'll come back and talk about hepatitis C.